travel out of people's homes, either statewide or in some of the harder hit areas?
Not at the moment. So we do not have active consideration of those issues. But obviously, this is a very fluid situation, and we will make the best decisions going forward as we can.
Governor, we've been asking the federal government to declare a state of emergency. President Trump has just done so. What is your response to that? What does that mean to our state? Who might that help?
Yeah, I talked to the Vice President about this yesterday and asked him to urge the President to make such a declaration. And that is helpful to the state of Washington because it will make some Medicare and Medicaid benefits eligible where they would not be eligible. It helps with the public messaging as well to let all Americans know how serious this challenge is. So it has been helpful. And I thank the Vice President for his help in this regard. I also had some discussions yesterday with him about the possibility of Washington State helping expedite some of the laboratory testing protocols that have been challenging, and a couple other issues. So we're glad that the federal government has helped in this regard.
Governor, how will you be monitoring food distribution?
I'll come back to
I just want to follow up on the school workers. You mentioned yesterday that the state of emergency might help them. How might it help them?
Well, it helps them possibly, and this is only a possibility at the moment, with coverage of unemployment insurance. The type of declaration the President made today probably will not be able to help in that nature of that specific requirement. But I'll tell you how it will help, and I'm glad this happened today, is to really add motivation of Americans to help us in this effort. And I'm really serious about this. You know, Chris and I and school directors and legislators, we're doing some positive things together. I talked to Republican leaders today. I really appreciate their leadership in the legislature getting the funding package through of $200 million. But the people who really count here are just, you know, John and Joe Smith, the citizens. I'll give you an example. What's really going to be the most effective thing here are people making individual decisions to do social distancing and keep this virus from overtaking the state of Washington. Small example, if we have to go into meetings, here's a small thing. Let's make sure that we have an empty chair next to us when we go into meetings so that we've got at least 6 feet apart. That strategy could be as important as any presidential declaration. And I say that really urging people to join this cause. I'm pleased that many are. I'm pleased that some of our older Washingtonians and those with health care are staying home and keeping themselves out of harm's way. We're seeing a lot of great things happening by private citizens, and we want to continue to encourage them.
Governor, how will you be monitoring food distribution in the school districts, and if and how will you deploy the National Guard to facilitate that?
Well, I'm going to let Chris handle that.
Thank you, Governor. We've got an expectation of our districts that they're going to use their existing benefits that they get. There's both state supports and federal supports. Again, that food supply is secure. Our warehouses are ready to go. Most districts are going to create multiple checkpoints in their community where families can come and get breakfast or lunch. Some of them are already working on distribution models where they're going to deliver and bring that. Our reporting system will be on several factors that the governor has asked us to report on: nutritional services, child care for healthcare workers and first responders, our seniors and juniors progress. All of these will go as an expectation that districts write plans about those, and by the end of next week we will be collecting those plans to know what the game plan is in each of the 295 school districts.
And so those plans will also include the coordination for child care for families?
They will, and again, this is one where a lot of them have very sophisticated systems already. They're already an ECAP provider, they're already a before or after school program provider, and it's a matter of sort of filling in the gaps. We do have districts who don't do any of this stuff right now, and so for them it's a harder launch, it's a harder start, and you might see them partnering with the nonprofit community or the private sector where there are capacity opportunities, and just simply utilizing them in partnership.
Do you have concerns? I mean, obviously, you're closing the schools to limit the spread of the disease, but you're going to be having child care. Do you have concerns about still the disease spreading through that, and are there any sorts of preventative measures or consideration to be giving in that realm?
This is a balancing act between making sure that we take the right health stance, and I think the Secretary and the Governor have really led on making sure that this state is going to be ahead of the curve in these large contemplations, the social distancing. We're going to reduce the spread of this. But there's a reality, too, about our society, and that is that every parent cannot simply say, I'm not going to work anymore and I'm going to go be with my child. We want to provide an opportunity for those workers to be on the front lines doing their job, saving a restaurant because that worker can be there to be on the job. That's a responsibility we have. We still expect school districts to follow protocols about social distancing, though. So I only mention as an example, we've heard from Spokane this morning who says, we have a plan in every building to provide childcare, but it's not going to be every kid back. It's going to be some limitations to that. There's going to be distancing protocols to that. We have 1.2 million students in the state of Washington between the public and private schools. We're not talking about all those students coming back. Your high school students, most of your middle schoolers are probably going to be at home, learning at a distance, or working on some sort of learning strategy. We're talking about a subset of elementary school students primarily, and some 3- and 4-year-olds who still need support because mom and dad or grandparents can't quite figure out that local child care option.
Can I add something to that, Chris? As far as childcare, I really believe that we need to get in the mode of World War II thinking of pulling together. You know, they had rubber and tin drives where citizens helped the war effort in World War II. And to some degree, we got to think about this childcare issue because we can't simply turn the schools just into childcare centers because the whole effort here is to reduce the transmission of disease. So we are really asking people to think of the schools as the child care center of last resort, and we want to make sure the priority of that is given for the families of healthcare workers because we simply cannot have nurses leaving hospitals when they become deluged with patients to do child care, and same thing for first responders. So families, we're asking them to look for alternatives other than schools to make sure that these folks and those in poverty, frankly, who really need it. We hope that that's the case. Somebody asked me about the National Guard. The National Guard will be available at the moment that there are requests for things that they can actually do to be helpful. That may be involved in some of the nutritional issues. It may be in some security issues. At the moment, those requests have not come in, except the Guard is now involved in the logistical issue at our Emergency Operations Center. They are on the job.
Governor, we have a situation on the National Guard. There are rumors out there right now that the entire state's going to be under quarantine in the next 48 hours. The National Guard is poised, ready to put a perimeter around the state. Restaurants are going to be ordered closed. Can you address that and dispel the rumor or ease some fears out there?
There are no known proposals or even consideration by any level of government that I'm aware of in this regard. We do have to guard against both viruses and rumors in this situation. And so I can assure you that I have not heard anyone propose that or even consider it at any level of government that I am aware of. So I know you're going to help us dispel rumors in this regard.
Governor, in Kent, there's a situation at a quarantine site there, a motel, where someone who was supposed to be quarantined apparently walked away. Is that a kind of example where maybe we need to get the National Guard if we have more quarantine sites with more positive tests coming in?
It could be. We have, as I've said, we haven't had a request for that type of service from the Guard yet, but we would certainly consider that, and the Guard might be able to provide that kind of security. I will say that we have witnessed a remarkable degree of compliance with voluntary decisions to stay in isolation. The person you're talking about, I don't know if they were under a legal restriction or just a self-imposed. I don't know the answer to that. But yes, the Guard will be there when we ask them to be there, and we know how talented they are.
To that point, Governor, are you doing anything to make sure there aren't more walkaways from quarantine sites? Because it obviously has the nearby communities nervous when that happens.
Well, obviously, if there are legal quarantines, that means a legal decision that a person cannot go out in public. I'm not even sure there actually are legal quarantines at the moment. I think the vast majority have been requests, and the vast majority of people have complied without any legal prohibition. But yes, obviously, if there's a legal prohibition, we'll exercise all due efforts to make sure they follow that legal rule. And the Guard could be helpful. As I said, when they're asked, they can be there.
The President and Vice President talked a little bit about last hour setting up drive-through testing centers and store parking lots. It would seem likely we would be the first to have that.
I'm sorry?
It seems likely our state would be the first to have that since we have the most.
Well, we have to some degree. The University of Washington essentially has I don't know if you technically call it drive-through, but it's a focus center that's very convenient for the University of Washington community. I think in Everett, I've heard that there's some consideration of setting up such a system. I want to mention this testing issue because I know people are concerned about it. I got a report yesterday that looked like the turnaround time for tests that when samples are taken are anywhere from a day to 48 hours. So in Washington, we've appear to have a pretty good system to get tests done in a timely fashion up and running. We know that has not been the case in other places in the nation. It's one of the reasons I talked to the Vice President yesterday. We're thinking about possibly being able to allow our labs to help the federal government in their responsibility to certify labs so that they can start really doing huge throughput. So we're examining the possibility of that right now.
Governor, I was talking to the House Minority Leader, J.T. Wilcox, this morning. He said, he supported your decision yesterday on King, Snohomish, and Pierce counties, but he said he had some concern about extending this ban across the state because of the economic disruption that it would cause and sort of the personal chaos in people's lives. And then that might be a very heavy cost in places that haven't even had any cases yet. What would your response be to that?
I talked to JT this morning about this issue, and I've appreciated his attitude towards this and Senator Schussler of the Senate, both. They've been helpful in allowing us to consider these issues. What I would say is that those questions are very, very legitimate. Look, to be concerned about economic impact of these closures, to be concerned about the family's disruption with child care needs, to be concerned about whether for sure we're going to be able to do the nutritional needs, these are really legitimate concerns. So I would say these are really important questions. And we have asked all of those questions in depth. And I believe we have come up with something that my health department has said clearly we have a clear and present danger of rather epic proportions in the state of Washington. I'm not sure we've ever faced this since the 1918 Spanish flu. And clearly there is a good reason, many reasons to believe that reducing the contacts of children in a school can reduce the transmission rate, and really good reasons to believe that to make it effective, you've got to be ahead of the whole peak of the epidemic. And really, and also clear that we have educational communities that have shown great creativity in solving these problems. So you put all those things together, and we've decided in a very difficult judgment call that this is in the best interest of all Washingtonians to take this. But I want to say I appreciate a lot of the Republican legislators who acted with great dispatch to pass this $200 million appropriation. And I asked JT that any concerns as this develops he has to give me a call, because there's things we can do to help local communities get through this. So far I think that's a good working relationship. You'll have to ask him specifically about his thoughts today.
Governor, there's been a report now, a Department of Correction employee up in Monroe tested positive. Are steps being taken to remove or transfer inmates to other facilities, lock down the prison? What's the response?
Yeah, I just was briefed about 2 hours ago by our DOC personnel, and I think they're doing some really strong measures. They're doing screening of employees as they come to work. They're trying to get some extra thermometers now to make that more effective. They have good isolation, I believe, strategies to isolate people who are either positive or have contacts. And I've been assured that those things are in place. We talked about some questions about whether we might want to curtail some of the work release issues that are going on when people leave a prison to go out into the community and then come back. There may be some sense in curtailing those right now to some degree, at least those who aren't doing essential services for the state. So that's going to be something under consideration. So I feel that there's good protocols in question. But look, we got to understand, this is a devilish virus. And when you have people who can go into an institution and infect people when they have no idea that they have symptoms, and we have hundreds of people going to work in these institutions, this is a tough nut to crack. And that's one of the reasons we have felt we should be proactive in making this a statewide closure of schools and making it a statewide reduction of these large gatherings. These are the most powerful things we can do against a very dangerous virus.
Quick question about the North Shore School District. Does your order require them to end their online learning that they were doing?
No, that's a very important point. Talking to the superintendent, it seems like they've had considerable success of that. So no, this would essentially allow schools to do online learning, to do different ways of traditionally having remote learning, and they've done that in many cases during Christmas break and spring break and snow outages. So no, it will allow, and we'd certainly encourage districts to do, what they can do on remote learning. Now, the difficulty of thinking about this, though, is districts are very disparate. They have different populations. Their kids have different technology at home. So, there's going to be probably some different decisions made on being able to use those systems. We have to accept that. But I believe that what I've heard, SUPs and principals are going to be as creative as possible in this regard. Chris, do you want to add anything to that or not?
Yeah, thank you, Governor. I appreciate that. They've described it as a temporary pause, and it's because they're really committed to the work, but they have also learned a lot in the initial days of that. The technology, I don't think, is a big barrier, but they are very serious at North Shore and elsewhere about this question of equitable access, and we're still working with our partners in the federal government to make sure that their regulations on us about this work, particularly students with disabilities and some other populations, can be met, and we're really partnering now with the superintendent there, and we're together on this. We want them to keep doing this kind of thing, but we also want them to do it equitably, and they're committed to that. Can I just say before my part wraps up, we've been working a lot of hours together, and the whole state is grappling with this, and we've said before, this is a moment like none other, a moment of perhaps once a century. But for 45 minutes of my life yesterday, I forced myself away from the office to watch a 13-year-old girl play volleyball. And it'll be her last volleyball game of her middle school years. And I say it because in this moment, kids feel a little robbed. And we're into the data, and we're into the science, and we're into the economic impacts, but I would challenge you once more to not be Democrats today or Republicans, or East Side or West Side, or rural or urban, or tech-able or not. We're Washingtonians today. And our communities need us to be extraordinarily outside of our boundaries. And that little girl laughed, and her team learned, and some amazing women who coached them were developing young people. And we're getting back to that day. We're going to get back to that day, but right now, we have to put away some of the framework we have about what we ought to be doing and what we should have been doing and where we're going to, what can we do together? And I'm looking forward to the day when we get past this as a state and we learn a lot from it, and kids are kids in school again, and that contact that they have with teachers matters. This online learning protocol is an opportunity for us. It is not the default model necessarily in a crisis, and it is not the default model when we get to normal times again. Schools matter, not just for the content, but how kids interact and how they relate in the social-emotional learning. And for 45 minutes yesterday, life was normal. And I'm really confident in Washington State we're going to get back there again. But for right now, let's be the ultra-human beings we can in shared sacrifice together to get over the hurdle together. And I know the state of Washington will lead the nation in that way.
Thank you. Be safe. Wash your hands.